afternoon, everybody. I'm Daniela Moshoiu, professor of palliative care at University Transylvania and Director of Education and National Development at Hospice Casa Speranței, the partner who is leading the RESPACC project. RESPACC means research, basic research competencies or core research competencies for palliative care clinicians. And this project really is aiming to bring research into day-to-day work of clinicians from palliative care. And it is a pleasure for me to welcome you to our third webinar in this RESPACC project. This webinar has been very important for us because we are trying really to encourage you to bring journal clubs as a way to get closer to research in your own teams. And you all know you have received special invitation to attend this webinar, and we hope you will attend also the second. And afterwards, you will try to implement in your own institution this practice of discussing journal articles with your colleagues. We have the pleasure to have two famous speakers today in the webinar. I'm sure you know them. Professor Carlos Centeno from University of Navarra, who's also leading palliative care clinic in Navarra. And of course, you have seen the APC, his APC work, the Atlas of Palliative Care, and he will be doing this webinar jointly with Dr. Centeno Mason, who is leading the education and research in postgraduate education and research in University of Leeds. Welcome to all of you, and we give the floor to our speaker, Dr. Centeno Mason.
Okay, many thanks for that, Daniela. And just to echo Daniela's welcome to you all for this session, which I hope you'll find interesting, stimulating, and that hopefully will prompt you into some action as well, and applying some of the learning and experiences that Prof. Centeno is going to discuss today. So just how this session will run, I'll hand over to Carlos very shortly. But Carlos is going to talk for about 30 minutes or so. And if anybody has questions, if you can please put your questions in the chat function, and then I can take those questions and give those to Carlos after the chat. Equally, once Carlos has finished the talk, if you want to ask questions directly to Carlos, then please just raise your hand icon in the Zoom meeting function. And again, we will come to you and allow you to ask directly to Carlos, because it may be a question that's more of a dialogue than a question. I would say to people if they can make sure that they are muted during the talk, just in case something happens. There's always usually some kids may run around or whatever, but if you can just make sure that you're muted. If people want to leave their cameras on, that's fine. But I guess if you have problems with the picture, it may be that we'll ask you to turn off your cameras just in case it helps with the bandwidth in terms of making sure that the talk can go forward. So it's a real pleasure to introduce Professor Carlos Centeno. I've known Carlos for a number of years now, from my early days as a very junior researcher working with the EAPC Education and Training Committee, when Carlos was starting off with his work on the Atlas. And I used to love our visits. We were lucky enough to meet up in some lovely places for our meetings, but I used to learn so much. So I think it's really a fantastic opportunity for us to have Carlos talk about the experiences of using journal clubs as a way to engage clinical teams and a way to try and promote understanding of the evidence base and just what journal clubs can do for us as people interested in promoting palliative care and promoting the best care for patients. So I'll hand over to Carlos, and Carlos, let you begin.
Thank you very much. Thank you to you, and thank you also for Daniela to introduce this meeting. First of all, I want to share with you my emotions in seeing you, people from all around the world. I'm seeing some friends here, people from Buenos Aires to El Salvador, Greece, Moldova, also people of my team. So my feelings are feeling of emotions, seeing this global interest for a topic, not for the speaker, but for the topic that is research, is to promote research in the clinical team. So thank you all of you for coming to this space for discussion. I will try to talk about my own experience. This is not an academic lecture. It's a colleague explaining to other colleagues what we are doing for years here in the University of Navarra, what we learned from others in the past, and we are doing in the present today. So I will share my screen now, just to follow the presentation. Can you confirm that you are seeing well the presentation? Okay. As you know well, I am in the University of Navarra, that is in Spain, at the north of Spain. So, journal clubs. The first that came to my memories, it was some years ago, a number of years ago. I was in Edmonton for training, Edmonton, Canada. That I remember in my very first days in that country, when I was younger than today, that I remember was Professor Bruera arriving to a room very early in the morning, all the people around the table, and in one moment, Bruera, from his pocket, take a piece of paper that was, in fact, one sheet of the Lancet that he was in the pocket in the moment, and just with that, start my first journal club. That was my first journal club. It was in that years when this paper that you have on the screen was written. In fact, Paul Denick was the fellow of palliative care that was in charge of the journal clubs in Edmonton at the times, and did a summary of the experience that he was having there in Edmonton in this beautiful paper. So I want to say this because that I learned about the journal club start at this point. I have to tell you that there is not many literature in the palliative care field about journal club. This is the only paper that I find in a rapid review that I did to prepare this meeting. What is my understanding of what a journal club is? It's a formal meeting of clinicians to discuss and explore research publication. Is that? In Spanish, in the Spanish world, we don't use very much journal club. We use more bibliographic sections, sesiones bibliográficas. But journal club is a funny name for us to show. Journal clubs. It's a useful educational tool and part of the continuous education program of a clinical team. Could be, I have to say, could be part of the continuous education program of the clinical team. Also, it's an opportunity to certify these meetings for continuous medical education. For us, it was more complex, and we don't have the certification of this meeting, but it's an idea, and I can suggest that also could do more attractive even the journal club for the people. So formal meetings to discuss and explore research publications. But in my view, because any of you can discuss these slides, because that I'm showing here is my view, my experience about the journal club is, and I'm very conscious that a journal club in Navarra can be very different at the journal club in other places. I only try to participate my experience to you, but I accept any other point of view about that. In my view, the aim of a journal club is provide a forum for discussing research methodology or current issues in palliative care, but discussing methodology is also one aim possible of the journal clubs. We try to keep the clinical team updated. We want to review present issues and care experience within the clinical team. That I'm trying to present to you is that we did here in the University of Navarra 16 years ago. The very first week that I arrived to this place, when my team, my clinical team, it was only 3 persons, 1 psychologist, 1 nurse, and myself. The next week, we start the journal club every Thursday. And since then, every Thursday, we meet to discuss a paper. And this is the experience that is on the screen and in my site. One of the most important issues to having journal clubs is the planification of the journal club. All of us are busy people, very dedicated to the patient, very compassionate, very supportive, and any of us has enough time to do important tasks. This is because the planification is crucial, is very important. My suggestion, I will say this later too, my suggestion is 1 person in the team has to be in charge of the planification of the meeting. What we do here in the University of Navarra, we plan in advance. We do the planification of the next 3 months, 6 months. We decide who will be the speaker with flexibility to break this organization, to split and to put other names if some opportunity comes later. But we do, as you can see in the sheet with the colors, we do the planification in advance, and then anyone in the clinical team that has to give us the session, the journal club session, knows in advance which day they have to present. This is the planification. Who can attend the meeting? Any can attend the meeting. Any member of the clinical team can attend the meeting. Furthermore, in my team, all members of the clinical team has to attend the clinical meeting. So the nurses, the psychologists, the physician, the people in training, all the people has to attend. I can say in some way it's mandatory to attend this journal club every week. Few years ago, we start also a research team that is different of the clinical team. Later, to start that research team, we also invite to participate the researchers and the researchers in training of the research team to that meeting. Through the pandemic, many of these activities became electronically by Zoom. So now the research team is participating in our journal club by Zoom, by a communication tool like Zoom. So usually the clinical team is in a room, and on the screen there is the researchers and many other people that is interested in the issue, sometimes only for 1 session, and other times usually attending the meeting. For instance, it's very usual that the pharmacists of the hospital attend the journal club, and the pharmacist in training is attending also. For instance, here there is another hospital very close to us. The specialist in pediatrics that is doing palliative care in that hospital usually attend also that meeting. And this enriched the discussions very much, because so we have not only the inputs of the clinical team, but other inputs for the pharmacists when we are talking about medicines, or for the specialists in pediatric, or from the research team, because in the research team someone knows more about that issue, or look at one methodological point that is interesting to discuss in that moment. So fellows has to attend the meetings, and also visitors. The visitors, we always have visitors in the clinical teams. Visitors always has a place in the journal clubs. Sometimes without articles, we miss the article and we share the experience of this visitor with us about his experience in the clinical team, or her experience in the clinical team, or in the organization of any issue. Special guests are welcome. I remember discussing the team when the first articles about the use of ketamine in very serious depression start to appear in the literature. We invite one specialist of psychiatry that was doing a clinical trial in our center about the issue, and we have very good conversation, very good meeting about that. So special guests are very welcome. Planning the meeting, we know who has in charge, who are in charge of the meeting, but every week on Monday, we remember to all who has to give us the session on the next Thursday, just for remembering, and has to prepare the things. Usually, an announcement is sent to all the usual participants by mail, to a mailing list. We attach, you have on the screen the email of the person in charge of that. Attached the PDF of the article, just in case that someone wants to review in advance the paper to be prepared for the discussions, or just to increase the interest of the people for the topic that we are going to discuss. So again, for all these issues, it's very important that one person be in charge of that, because we are very busy people and we don't have time to remember who is in charge of that. Where is the paper? Did you send me the paper to share with all? So one person has to be in charge of that. Now, the article selection. How we decide which article will be discussed? There is no rule. Let the presenter decide who is in charge. He has or she has to decide the paper. And this is very interesting, because in that way, anyone understands that this is my contribution to the team. This is my contribution. What can I add to this clinical team? And with this leitmotif, things going very well. We give to the presenter some orientation. This is your contribution. Think in something that could be useful for others, or think in your line or interest. For instance, I am very interested in methadone. So 2 weeks ago, one article from Mercadante appeared, and I asked, please let me place to present this article on methadone that could be interesting for the team, because it's my interest. So the presenter, many times, for instance, the psychologist of the team, Marina Martinez, is following the line of dignity therapy. So almost always Marina present something about dignity therapy, the dignity question, the PDI, and so on. She follows the line of interest because any member of the team present every, I say, 6 weeks or so. There is no problem that you always choose the same topic for the discussion if something new appears in the literature. Sometimes we present new issues, new things, recent or very high impact articles that arrive. This is some examples in the screen. But also, we are not attached to the paper. If a new protocol appears or we are doing new research, why not to present the protocol in the team, in the journal club? If the National Association present a new guidelines on palliative sedation, why not to choose the journal club? I remember, for instance, when the Vatican did a very important document about the Samaritanus bonus, about issues around end of life, we use the journal club to present the topic in the team. So papers, but not always paper. There is also place for other conversation about other documents that can be of the interest of the team. Conducting the meetings, very easy. It's one fixed date in the week. In our team is on Thursday. In our team is linked with the daily clinical team meeting. So every day we have a clinical meeting in the morning, we're taking coffee together. And that day, the Thursday, that clinical team is more synthetic and there is a place for the journal club. Only half an hour of journal club, okay? Maximum half an hour. 15 minutes for the presentation and 15 minutes for the discussion. I remember that in Canada, all was happening in 15 minutes, but was every day, not every week. So in 15 minutes, they did all. No, in my team is once a week and 15 minutes. The clinical team is all together. The coffee usually is ready for any that wants to take one coffee during the meeting. We prepared that coffee in my desk, in my room. Some researchers are attending by Zoom, as I explained first. The administrative person prepared the room for that is in the slide for the meeting, and also the paper in press. The paper is printed and is awaiting the people in the room. As I say, brief meeting, 15 minutes for presentation and 15 for discussions. Usually we recommend to start with the context, why you choose this article, because it's your interest or because I think that is important, why this article, and a brief summary of the authorships, if you know the place or the affiliation of, it's very useful. It's very useful to talk a little bit about the quality of the journal too. It's not only one orientation of the quality of the article. It's true. No, it's not. It's not it's not the most important, but sometimes it's an orientation. This article is in Journal Citation Report journal, and the impact factor is over that, and the quartile is that. One overview of the quality of the publication. And then free format for the presentation. Today, that it was Thursday, the fellow of our team decided to use a presentation with the slides. That's fine. In fact, facilitates very much. The slides was very well prepared. Thank you, Judith. The slide was very well prepared. And we can follow very quickly and very easy the presentation. But it's not mandatory to have one presentation. Many of us use the paper. Having the paper in hands, comment only one table, or comment only the abstract, or comment following the article in several paragraphs in the presentation. It's very important that the final words of the speaker be his own evaluation, because it's a person that prepared in advance the article. It's interesting that that person give us his judgment on the article. What do you think about the quality of this article? What is your point of view? Because the people many times cannot enough time to analyze the quality of the article, but you, if prepare the article in advance, are ready to give this overview on the quality of the article. Then the discussion, very interesting moment, the discussion. Question or comments are welcome from anyone. Sometimes we talk about methodology, other times we are talking about the implication, which implication this has for our clinical daily work, but also new ideas or disruptive ideas are very welcome. Sometimes we experience here the influence of the culture. In my country, in Spain, young people or the fellows sometimes has difficulties to speak aloud when several audiences. That you have to give to the people the security that this is a safe environment. No criticism has place in that meeting. So please, any idea is welcome in the room. Also, it's an opportunity to emphasize the way that present that person. If the slides are well done, you can see that. And if the summary was very interesting, it's the moment to give this positive feedback, to give constructive comments about the way that the person present. This is also, this has also a place in the discussions. Usually, I recommend that the seniors wait that all the juniors staff comment on the topic, and the elders of the seniors comment at the end, not at the beginning, just to give more freedom to all people to participate, in giving any crazy idea if they have crazy ideas to say. So, and very important also, the leader has to close the meeting in time. You know, many times you feel very well in that meetings because it's a moment for relax, the discussion are very interesting, many points of view are coming, and this is because I put a clock in front of my position in the room to have the control of the time, and this could be useful to put a clock on the wall too. Now we evaluate each section. Since from 2 years ago, we think this is very important that we are doing. Why not to evaluate this session? And now it's very easy with Google Forms or with many other platforms. You can evaluate very easily the meeting. And at the end of the meeting, the people receive one email in the mailing list, one email with the evaluation. And many people can evaluate very easy in the phone in 1 minute, because the evaluation has to be very, very simple. What we evaluate the topic chosen, the topic, the quality of the presentation, the engagement of the participants in the discussion, and one overall evaluation of the meeting. As you know, Google gives you the opportunity to see the live evaluation process. You can access to the evaluation that other people did just before you. Very important, evaluation has to be anonymous, and we state this at the very beginning of the evaluation form. In the last year or so, less than the year, we give the person in charge of the journal club send the feedback of the evaluation to any presenter in the same week or even in the same day. The presenter, the speaker, receive this formulary with the evaluation of the session in comparison with all the sessions that we spent in the last year. So just to give feedback on that. And this is funny, it was not planned before, but one member of the team usually take a picture of the room and a picture of the article and disseminate the meeting and the article on the topic that we discussed this week by Twitter. And many people is following the journal clubs in that way. We can see here several of the more recent Twitters that is sent by Dr. Rocío Roji of my team every day. And finally, golden variations. The journal club has also variation, as the Goldberg one's variation of Bach. We have variation. One variation it was that years ago, the people that spend some time with us doing training enjoy very much the journal club, and very spontaneously they asked to us to meet once a month to discuss one article together. And in that way, we are having that we call intercontinental Ateneum, Ateneos Intercontinentales. Once a month, we have a journal club, first by Skype, that was lower quality that we have now by Zoom. That you have on the screen is people from Buenos Aires, people from, I say, Guatemala, and on the corner on the right, it's Ancu Fem in El Salvador that is attending this meeting today too. Hello, Ancu, I know that you are there. So in that way, we have journal clubs with Latin American teams every month. The same teams that people that receive training in the University of Navarra meet once a month. We know also that there are Italian variations, people that from Italy that was training with us decide to have his own journal club, and they meet once a month to speak in Italian about one article in the country. Similar experience. And finally, we did the experience, a very good experience with the students. We offered to them during the pandemic, because it was not permitted to attend the clinical environment. They has not attended the hospital. We offered to them the participating the journal club. And we enjoyed journal clubs with more than 100 students attending the journal club. We did the evaluation of that. It's prepared for a publication that we hope to do in the next month. Dr. Roji is in charge of that. It was a good experience. We learned that this has to have a special condition to arrive or to arrive to the students, or to allow to the students to have more interest in that. In summary, my thoughts about the benefits of the journal club. As a conclusion, I think that the journal club is a beautiful way to offer updating, significant update to all team members. You think that we have a meeting every week, you can understand that more than 40 papers a year, it's a lot of science, a lot of knowledge that are with arriving to the clinical team. But I want to say that also it's a team building moment because the Journal Club give to the clinical team a sense of belonging, of pertinence. You are of this team that is discussing this issue every week or all at the same times. It's a team building moment because we are all together there, the nurses, the student of nursing, the psychologists. We are equals in the room with respect to each other. The nurse present articles as any other, the psychologists present articles other times, and all respect different points of view. And it's opportunity also to teach, to respect the others, to the younger people in the team. And also, as I explained, one opportunity to contribute. Keep in mind that this is a training the trainers activity because we are teaching in the Journal Club, we are doing presentation, and it's a way to do this later when you are in other kind of environments. Clinical team has to teach always, have to give courses, sessions, so on. Also, it's a good way to contribute to the academical respect that the clinical team needs in their environment. Could be in the community or could be in the hospital, because the people knows that the palliative care team once a week discuss an article. So this is a good practice and the people recognize this as a good practice. Also, it's a beautiful way to build the clinical criteria in the team in a natural way, because in a team, people has to do things in similar ways. If you are using methadone in first line, or you are using ketamine in difficult pain, or how to use, how to manage bowel obstruction, and so on. So this is my thought. The Journal Club offer many benefits to the clinical team. So this is my thoughts. As you know, this is part of a collaborative effort of all these institutions. And now we are open for your comments or for your points of view or for your question if you want.
That's great. Thanks very much for that, Carlos. That's really a lot of effort I can see squeezed into a very short presentation in terms of the development of the Journal Club and your experiences of running it, which is great. I'm really interested that that your club was mandatory, and I think it's one of the challenges that we sometimes have is that everyone is so busy that actually people say, I can't come to Journal Club today, and there's so actually it's one. Yeah, how do we kind of make sure people join in, and other things as well? I think again, very simple things for us to learn, like having junior members of the team respond primarily before more senior members, so that it's not threatening and that it's not seen as an evaluation or examination. So I've lots of competent questions, but we do have some questions from the group. I think some might have been addressed in your talk, but we can go through them. So Nicolita has asked, how can we, involved in education and research, make it possible that the research presented in Journal Club is implemented into practice? So from your experience, what factors help that process in terms of the lessons that we learn at Journal Club? How is that part of the focus of a Journal Club? Do we try to make sure how it makes a difference to practice?
Yeah, thank you. Thank you for this very interesting question. I think that my answer is yes, but in a very natural way. What I mean, I can give you an example. I I explained about that article from Mercadante about methadone in first line. We present this article in the Intercontinental meeting last week, I think that it was. Immediately, people share his experience with methadone in first line, because the people of, for instance, El Salvador, Dr. Carlos Reyes has a lot of experience in that. And the other article that was published was from Buenos Aires. And then people from Buenos Aires talk about this new article. And then this week, I used methadone in one patient in first line, but my fellow, Dr. Rocio Roji, did the same in one. And today, I have seen the two patients, myself, with methadone in first line, with the same doses, because immediately when I did that, I said, Rocio, one patient with pancreatic cancer that is with neuropathic pain, I put that patient on methadone. So in the real world, we are using that we learn. Other times, it's not the application to the clinical work, but it's the beginning of a research project. I talk about the dignity questions because we are interested in the team. We are very interested in dignity therapy. The psychologist was training in dignity therapy. Myself did the training too. So we are interested in that. Through that way, when one validation of the inventory of dignity of Harvey Chochinov was presented with the Journal Club, one person decided this could be very interesting to have translated and validated in Spanish. So one person said, okay, and that person is here in the audience. I have seen that person. It's Alasne that is in the room. And Alasne think this could be one opportunity for the intercontinental people. And we did the validation in Spanish, and it's published already, the validation of the Spanish in Buenos Aires, Salvador, Guatemala, all together, and this is published. I can say the same about early intervention. Dr. Noguera, that is attending the meeting, because I see his name in some place, after to study several papers about early intervention, he did decide to do one feasibility study of early intervention in palliative care. And it's already done and was presented in an article. So my answer is yes, from the Journal Club, you arrive to the patient, to the clinical work, and from the Journal Club, you can arrive also to research and then to other patients.
Yeah, it's an interesting point, I think, isn't it? That there's a tension that we don't want to turn, well, maybe people do, but I don't think we want to turn the Journal Club into a formal evaluation that prompts changes to practice. But I think it's interesting to look and see where practice changes maybe come from Journal Club, such as, yeah, the dignity question, and then someone applying that in practice. So it's really, it's interesting to find out its effect, but I guess we want to maybe keep it not informal, but something which is open rather than people feeling it's forced training. But that's yeah, that's really an interesting point, and how we might do that. Some other questions that came through that I think you maybe touched on in your talk, but so is it just a researcher present, or do all clinicians present? And I think you said all of your team are invited to present, yeah?
Yeah, initially was only clinician presenting, but because we have now the two teams, and we also have the facilities to connect the two teams that are in different buildings by Zoom, I think that it's a way to put the researchers in contact with the clinical team, and to have the clinical team in connection with the researchers, because we are the same team, really. So it's a way to communicate between all of us. Sometimes Maria Aranchamendi prefer to attend the hospital to present the paper the day that she has to present. Other times, other researchers prefer to present from his home or from the research environment. But it's a natural way to put in contact, in connection, the clinician with the researchers and the researchers with the clinician. And then that we do indeed planification, it's every 3 or 4 clinical presentation, one researcher has to present. This is that we are doing now.
Okay, I suppose a follow-on question from that then is, do you give the presenters a specific framework to follow in presenting their paper, or do you allow them to talk as what interests them, for example?
Any freedom. We love freedom. So, and it's the responsibility of each one, you know. Anyone knows that his fellow or her fellows will do some judgment about the presentation. So usually the people do his or her best for the others in the clinical team. In that way, you don't need to encourage any framework to the people, because also the people learn from the previous presentation. For instance, we have every 4 weeks, we have one student of nursing that is doing the Master of Palliative Care and Oncology Nursing, and is with us. The last week, she has or he has to present, but he or she learned from the previous sessions. Sometimes the young people looking for the advice, but this is not mandatory, but this is in natural way. Carlos, what do you think? Or Rocio, what do you think about to present this article? Or Carlos, do you have something to present? That do you think that, for instance, people in my team has a very good level of English, much better than mine. But also there are people that has a lower level of English and they prefer to present in Spanish, and they choose articles from the Spanish journal. Nothing happened. It's up to them to present and to choose the article and to choose the way to present. And yeah, in this variety, we have the enjoyment, you know.
Yeah, and that's, I was thinking, because I was interested in your point about the learning opportunity as well, in terms of a train-the-trainer opportunity. And again, I was just thinking of that balance between, for example, someone using a specific framework, say giving someone a framework from the Equator Network, you know, on one of the, this is how you critically review a systematic review or a randomized controlled trial, and that might formalize things a little bit too much. Yeah, that's an interesting good point. Another question that came, which I think also you kind of touched upon as well, is who decides the presenters, and does the person have to have specific qualifications? So I think
no qualification at all are needed to present one article to the team. The decision is already taken. It's all has to present. Usually, fellows or people in training has to present W than the staff. The staff has to present 1, the fellow has to present 2, usually. So with this general orientation, the administrative person, the assistant of the team, do the list and send the list to the clinical team, and said, this is the preliminary list. Anyone has problem? Is nothing, say nothing. So this is the definitive list. If some issue came later, you have to change with other. And
maybe a practical question, Carlos. How do you encourage junior members of the team are very, so I'm aware that in our journal club in Liverpool, we recently had a paper that was based on a German study where they looked at the cleaning of hospital rooms and the impact that that had. And they engaged some of the nursing assistants, so unqualified staff, to help present this, who were very nervous and very unsure and felt very, they didn't belong at the meeting, but their insight was amazing, you know, and they're, so I guess it's a question, how do we make sure that when we say all of the team, that actually all of the team are included, and how do we encourage junior members to present?
It's difficult to answer because our environment it's a friendly one. It's a friendly environment. So this is usual in our team. We did this in the last 15 years. So any that came to the team has to do what the team is doing. So there is no discussion about that. Usually there is no discussion. We understand if one person is nervous the first time, we understand that. Some people that became nervous, I have seen this, to have the article written, the comment written, and read the article. Nothing happened. That's good. And as you say, anyone can give you inputs. You know, I received beautiful inputs from a student of nursing in the journal club, and it's an opportunity because the opportunity is not in the person that is present the article. The opportunity is in that group together discussing an issue. Sometimes the article is the less important in the room. Sometimes the most important is the point of view of a very young person about palliative care, and this encourages others to have new ideas and so on. So the article is the excuse to be together discussing scientific issues or in a scientific way. And the people has the article to know more in the next days if they want. So
I like that very much. I like the idea that the article is the excuse to have the team together to share learning, share experiences. That's a really great, nice view of it. I think we need to close this webinar because we've only got 3 or 4 minutes left. But just to thank you, Carlos, it's really fantastic for taking the time out to put together the presentation and to talk us through your experience. And I'm sure if people have questions, they can mail you or contact you if you. But yeah, that's really interesting, and I think has probably given many of us lots of food for thought about our own journal clubs that exist or starting a journal club next week, which is great. I just want to thank you very much. I just want to share with people, if I can, the next webinar that we have. Let me see if I can. So we have a webinar in next week, which is presented by Professor Charles von Gunten, who's the editor-in-chief of the Journal of Palliative Medicine. And he's going to talk a little bit more about his experience with journal clubs. So again, I think if you found today's session really helpful and interesting, again, listening to Charles next week's on his experience about generating interest at the engagement of the clinical team will certainly complement what we've gone through, what we've discussed here today. And it's also just to point people to, as well towards 2 more of the courses which are part of the RESPACC project. There's a training course which is in Athens in Greece from the 2nd to the 4th of May, which is introducing clinicians to critical reading and academic writing. And then there's a 5-day program on translating the clinical issues into research projects, which is a blended program of online sessions and opportunities to speak to researchers around various aspects of everything from how do you conceive, how do you turn an idea into a research question, how do you develop a protocol from that, how do you apply a methodology, and then how do you disseminate your results from that. And again, that's from the 26th to the 30th of September in Bucharest, but again, there will be online options for that as well. There is a link in the Google chat, and there is a link here as well that you can either, when the slides are sent around, you should be able to kind of click on that, and that should take you through. Okay, so that's our webinar finished for today. I will hand back to Daniela, and if she has any comments to close.
I was just thanking our speakers and our chairman in the chat. I think it's great suggestions, great ideas. I really enjoyed it, and I hope everybody enjoyed it. And I really hope that we will be together also to get more clues from Dr. Van Gunten on the 6th of April. And also, I hope you are getting more and more interest in research, and you would be interested also in joining us in the courses that Stephen was just talking about. And the final aim is really for everybody to start journal clubs in their own settings. So I think
every week.
Sorry?
Every week.
I learned from you, Carlos. Actually, I learned 2 things. Every week, do it often, and put everybody to do it. So I will change in our setting the way we do the journal club. It seems to work so smooth in yours. So congratulations.
Okay, thanks, guys.
Goodbye and see you.
Thank you, Stefan.